Assalamu alaikum. So today is 24 of December 2023 and this year is going to be end soon. So today we will discuss about the inflammatory condition uh, hydradenitis suppurativa. Okay, so what is hydradenitis suppurativa? Normally, the follicles are present over the skin, the hair follicles, and the follicular occlusion will lead to the folliculitis. And the skin flora will cause superimposed infection. What type of bacteria? Like staphylococcus aureus and propionibacterium acnes. So these skin flora will cause superimposed infection along with the folliculitis, and it will lead to the chronic suppurative painful skin abscess, sinus tracts, and scarring. Chronic suppuration, and then painful skin abscess, sinus tracts with scarring. So this is the pathogenesis of hydradenitis suppurativa. Okay, so you can say this is the skin infection which starts with the follicular occlusion and will lead to the folliculitis, and the superimposed bacterial infection um, will lead to the painful sinus tract formation and scarring. So this is the hydradenitis suppurativa. So in which type of the glands it's usually occur, and what are the common sites in the body? So type of gland usually occur in the apocrine glands, and the sites are most common in the axilla and groin. Okay, so most common sites are axilla and groin because the apocrine glands are more numerous in axilla and groin, and also in the scalp, breast, chest, and perineum. Okay, hydradenitis suppurativa more common in the females. So the male to female ratio is 1:4, and it's strongly associated with obesity and smoking. So this is the pathogenesis for the hydradenitis suppurativa. There is a classification known as the Hurley classification for staging of the Hidraadenitis suppurativa. So, in stage 1, so if a patient come to you and you have to categorize at what stage the patient is. So, with clinical examination, you may categorize the patient in 3 stages. In stage 1, is single or multiple abscess formation. Okay, but no scarring or sinus tract are there. In stage 2, the patient usually presents with recurrent single or multiple abscesses with widely separated sinus tracts and scarring. And in stage 3, there is diffuse involvement of multiple areas, diffuse involvement with interconnected multiple sinus tracts plus abscess with scarring. The whole area is involved. So this is one is the diffuse involvement. So this is the classification. So now comes to the treatment part. First, advise patient to stop smoking and reduce weight. These are very important as it's more vulnerable in the patients who are very heavy smokers and overweight. For stage 1 treatment, you may only give topical antibiotics, and clindamycin is a drug of choice. And also you may give also intralesional steroids. As the only abscess are there in the first stage, so you may go for partial deroofing or debridement. So this is the treatment for stage 1. Okay, then comes to the stage 2 treatment. You may, and the treatment for resistant cases of stage 1 also, you may proceed to the stage 2 treatment. So the treatment is same. So it starts with the oral antibiotics because the topical antibiotic is not working. And the treatment of choice is either clindamycin, and in adults you may go for tetracycline. And also excision of the tracts. While in stage 3 and resistant cases, you may give TNF alpha inhibitor like adalimumab with wide excision because the area is more diffuse involvement, so the coverage will be needed in the future. So coverage, you may cover it with either with graft or the flap. Okay, so as we already discussed that you have to stop smoking and reduce weight in the overweight patient, you may also advise some like antiseptic soaps and tea tree oil and wearing non-compressive and aerated undergarments. Okay, so the topic is almost complete. Usually, it's not uh, given in the books, like you will have only some part of this topic. So, I decided to discuss this topic with you guys. So, if you guys know any other things related to this topic and wants to include the things in the discussion, so you may comment in the comment section and also like the video and subscribe the channel. Thank you.